mean to patients and carers, especially in relation to access and expectations of service users? What is the impact of development in social care on other community health services?
Well, I suppose this is, as you say, this is sort of treading into the territory we were just exploring, and I think the Act, in terms of in the way in which it's changed some of the systems, creates different opportunities. But I think, and I suppose this goes to the heart of some of those questions, your question for Baroness Osamor about what can we learn, is that actually bringing together institutions and organisations, commissioning structures together into forums where they can do things differently, doesn't necessarily deliver the long-lasting change that we're looking for. So I think it's really important that we are considered about the opportunities that ICSs potentially will deliver, or the benefits that they will deliver to patients. I think it's opened up a range of opportunities. It will now be up to individual systems to think about how they grasp those opportunities and take them forward, because it would be entirely possible for an ICS to continue to operate services in its area where nothing will change for patients. So I think that's the first thing to say. So the thing we need to be looking for is how ICS is going to take that opportunity. We've talked about the types of services, the paradigm shift that we would be looking to see on behalf of older people, and obviously the fact that social care is involved in these organisations, in systems now, is important, but I think there's still questions about, do they have the parity within those systems in order to make a significant impact, because social care, as Emily's already said, is going to be a very significant part of this solution and in delivering these different models of care. But then I think it goes back to partly, what are we measuring them on? What does success for an ICS and a system look like? And again, I think this goes back to some of the heart of those questions of where have things worked or not worked in the past. Partly perhaps because we've asked the wrong questions of what success may look like. So when we've looked at integrated care in the past, the question that's always been asked is, does this reduce hospital admissions? Has it reduced traffic into the acute sector? And I think the experience of some of these previous integrated care examples is that it hasn't necessarily done that, and therefore it has not necessarily been considered successful or sustainable. When actually the question we ought to be asking is, has it delivered better care? Has it delivered better outcomes and experience? Are patients healthier, happier, receiving better services? Are staff more satisfied with the services and the work that they're doing? And I think that's the prize that we really need to focus on. Oh, it's not just about less resource use, it's better resource use that's delivering better value for the patients and the carers that it's seeking to support, which may not quite translate through always to less acute sector activity. So that's where I think we perhaps asked the wrong question about some of these things in the past, and where we need to ask the right question and set the right expectations if we're going to deliver the potential benefits of the Act for patients.
Right. And then